So once you've got the software open, we can see here we've got one volume viewer, anatomy 1. So we've got a few things to go to here. Firstly, this view is called the axial view. It's in the top left-hand corners of your screens. In the bottom left down here, we have a coronal view. And over here in the bottom right, we have the sagittal view. Finally, we have a fourth view, which is called a volume rendered view, and that's here in the top right. Now you'll notice that for each of these images, there's a tiny little human head shown in the corners. And this is to orientate and remind yourself where you are. So let me just show you this one. We can see in this view, this is what axial slice is. And this is if we took slices through the patient from head to toes. In this particular case, the patient's nose is pointing down. If we come down here, this is coronal. We can see this is the patient facing you, which remember is the way we always look during radiology. When you take a DPT, the patient is facing you. So this is the patient's left, and this is the patient's right. Exactly the same as the panoramic. And finally here, a sagittal. A sagittal is looking through the patient from one side to the other. So from here, from left, going through the patient to right. Now down at the bottom here, we'll notice we've got this graph-like thing. This is called a histogram, and this is the contrast, brightness, the graphical representation of what your images look like. If you hover here, you see in the middle, you get the 4 arrow lines. So I'll take it off and just show you. So I'm here on the green. And if you move it around, you'll see we can change the brightness and the contrast from something like this, which is a terrible image, pretty good in the middle there, and over here, not very good as well. So we want to get it somewhere where we can see the difference between the tissues. This might not sound important, but it is quite important that we get a difference between the air and soft tissue. So there's air in the nasal cavity, there's some soft tissue in the nasal cavity. We also need to tell the difference between different types of bone. We've got medullary bone and we've got cortical bone. And then we also need to tell the difference between some tooth structures. So we've got enamel, dentin, pulp, a little pulp stone there. And then we also need to be able to see the lamina dura and PDL, which as we move the scan around, we will be able to. So this histogram looks pretty nice to me. For those of you who want to change the contrast in a different way, you can window it, and this reduces the number of blacks, whites and greys. So if you go this way, everything's very grey. If you go the other way, there's almost a very stark contrast between blacks and whites. So you want to have this just so you get a nice smooth view. You can see here that that looks pretty good to me. Once I've set this, I'm going to get rid of it so a bit more room on my screen. And if I go up here, see this box here in view. When I hover over it, it says view the histogram window. I'm just going to click that. And see when I click that, it disappears and just gives me a bit more room on my screen. So this is where I am up here in the view box. This view has not come to yet. This is called a volume rendered view. Now at the moment it's coupled to these views. And I'll show you what I mean. When I spin these views round, it will spin too. That's fine. See how it goes a bit grainy and the software goes a bit laggy, and also it's quite tricky to see what's going on. So I personally like to decouple it, and the decoupling button is over here. See? Decouple slices and volume rendering, and that's all it does. That's the volume, that's the slices, and it's got a little link. If I click it, it will delink it, and see now we've got 2 chain links that are separate, and this view here is now able to be moved separately. So what I'm doing here, just using my normal left mouse clicker, and I can drag and move this person around. This volume rendered view is really helpful just to orientate yourself so you know which part of the patient you're looking at. Some of you will notice there's some colour lines that go through the patient. I am sorry if any colourblind, there is not an easy way around the software in this instance. Some of you will notice that the line that comes across that plane here that you can hardly see now matches this red line here. And then the line goes front to back, the green line is represented by this green line, and the blue line cuts across the face in coronal, and is there the blue lines. When we're on the coloured lines, let's look at these in a bit more detail. In this picture, you can see we've got a vertical and a horizontal, and again, apologies if you're colourblind or struggle to see, but the colours of these lines, they're not green, neither of them. In this image and this image, we have a green line. That means that this picture is this green line. So whichever colour you cannot see, that is the picture. This green line here is this picture. The same thing up here, we haven't got a red line. So we look, the red line across here cuts across the teeth. You can just see it's just between the crowns of the teeth, which is why we get this picture of some upper teeth and some lower teeth. And then finally the blue, you can see there's no blue line here, so this blue line is represented here. So we've done the axial, coronal, sagittal, and we've done the volume rendered view, and we've sorted our histogram. There's one final thing with the volume rendered I'm going to show you. I can spin it around with my left mouse click, but if I right mouse click and drag upwards, so I'm clicking the right clicker now, holding it in and dragging the mouse upwards, during the patient. So that means I'm taking tissues off. The densest tissue remains, which will either be, and it will be restorations, which this patient doesn't have. But you can see how this picture looks, we've basically only got the crowns of teeth. If I go the other way, so I'm right clicking, holding the button, that's a right click and drag down, right click and hold, drag down, on the bone, and now I'm into the soft tissues, and we can get to a point where we get in. If you look here, that's the patient's lips, and there's the patient's nose. That's the soft tissue of the nose. There you go, that's a nice view of it. There you go, that's the soft tissue of the patient's nose. That's their septum, and this is the alar. Obviously, the front of the nose has been chopped off by the scan, which is why it looks this way. It looks a bit unusual, but there, that's the lip commissure there. And I've done that by right clicking and holding and dragging down. So I'm going to right and hold and drag up, and the teeth off and go back to them. That looks pretty good to me. That's important because we don't want to assess perforations of roots using this view, because if you look here now, over this upper sixth, it almost looks like the bone is so patchy. There's almost no bone over the roots, when that's not true, because I can add bone on like this and cover the roots up. But there you go, you can't see the roots of the sixth at all, but I can also effectively debone. I can uncover the roots. This is just for helping yourself orientate yourself, just to get to the right idea. It's useful to show patients some things, but don't use it primarily for diagnostics, things like bone levels, bone loss, things like that. Okay, that was the first tutorial about how to use the basic software. I'm going to start again on the next tutorial with how to line things up. Okay, the next stage, the next skill we're going to learn is about lining up the arch. So what I mean by that is none of these coloured lines actually correspond to any of the arch lines. We know that the posterior aspect is roughly front to back. So if I grab this data and I'm going to left click and hold, spin it round, you can hopefully see that green line is now looking pretty much along the arch, and lo and behold down here, our new view, which we're going to call parasagittal, now shows the teeth in a lot better detail, in that this is more traditionally how we will look at the arch. So here we've got a 3, a 4, a 5, a 6, a 7 and an 8. Now Conium CT, as we've talked about, has very small voxels, and that's part of the spatial resolution, which is one of the things that makes it really good. The reason why this view doesn't look much like a panoramic is because we've only taken that very thin green line. If I right click here on this picture, go to thickness, and increase the thickness to something like 12 millimeters, you'll see that now this looks more like a panoramic, doesn't it? And what I've done is I've asked the computer to take 6 millimeters this side, 6 millimeters this side, that's 12 millimeters total, and squash it all together. And that's effectively what a panoramic does. So this looks much more like a standard panoramic, much more like a normal dental x-ray. That's fine, but it's not really why we use CBCT. So I'm going to right click, go to thickness, go back to 0. 0 will be the finest cuts. You can see that when we go to the finest cuts, it gets a bit grainy. This is totally normal, and it's because we're going for the very finest detail. And the analogy to this is if you take a picture on your camera phone, and if you zoom in and in and in and in, you get this sort of appearance when there's always too few pixels. So if we go thickness and change that to 1 millimeter, you'll notice it just softens it slightly. And what this is doing now is taking a 1 millimeter slice. So it's still very, very thin, but it's giving you a bit more detail in the pictures. Now we've lined up the edge so we get a nice view from front to back. That's lining up the arch. We're going to now line up a tooth. And the tooth I want us to line up is the ectopic maxillary canine. If we look at the volume render, hopefully you can see we've got a 1, a 2. That's a bit small for a canine. It's actually a C. If I de-render the patient, hold, right click and hold and drag up, there's a 3 that's unerupted. We can also see that 3 if I move my red line up. There we go. There's my unerupted maxillary canine. In this case, upper left 3. Let's line that tooth up. Now what I mean by this is to line it up with the coloured lines so we get the nicest view. How we line things up? We target it in the axial plane. So what I mean is, there's the tooth, this is my axial plane, I'm going to put the coloured lines on the centre of the root canal. Can you see here I'm bang on the middle of the root canal. I don't want you to be inside, I don't want you to be somewhere in the region like this. I know this is touching the 3, but it's not enough. We need it to be bang on the root canal. If you go between the coloured lines where they bisect, you can move both at the same time. But if you a bit much, you can grab the coloured lines anywhere and do them individually. That one there, I'm going to put this one here. Once we've got them like this, you can see the other views. We get a partial view of the tooth. But here on the coronal, it's not very good. And here on the sagittal, it looks good, but there's more to the story than is showing here. What we need to do is line that tooth up with the blue line. If this was a clock face, it almost looks to me like the canine root is pointing to 1 o'clock. We need it to point to midnight. So what I'm going to do is going to rotate the data. I'm not going to move my coloured lines. My coloured lines are fixed where they are. I'm going to get the data, click and hold on the left button. That's click and hold on the left button. And spin it round. And watch how now that tooth starts to line up with the blue. This way I've gone probably too far. This way not quite far enough. Try and get it so you're bang on the root canal of the 3. Now if we look at our other view here, you can see that this is not quite lined up. It's sort of a few minutes past 12. I'm not going to move my coloured lines because we're bang on the root canal here. I'm just going to rotate this one. So I'm going to rotate it slightly. And when we do that, you can see now that this root got longer and we got the whole apex. Let me just show you how it was before. We were slightly off and it looked like the root ended there. But that's not true. If I spin this, you'll see that I get the full root length. So now we've got the tooth lined up on this plane and on this plane. And this is how we get the nicest view of the tooth. If you want to get an even prettier picture without the coloured lines, let's come back to the view box. We already did histogram before, which was this one that took the histogram on and off, but next door to it there's this button, which says show or hide the positioning cursors. If you click that, you'll see it gets rid of the coloured lines. Now the ends of them are still present, and if you hover over here where they would be, and if I click, they come back instantly. Hover here and click, they come back. So I'm a mouse pointer, when it turns to the double arrows, click, or all four. So they're still there, they're just hiding off the screen. But now we get a nice view of the tooth that's lined up. So that's how you line up a single rooted tooth. We're going to line it up along the coloured lines and then take your coloured lines off to give yourself a nice view. When I said about dental tissues earlier, I spoke about enamel, dentin, pulp, PDL space and lamina dura. And if you look at this picture here, you can clearly see them all. There's enamel, there's dentin, there's pulp. And look along this side, you can see the lamina dura and PDL. If this picture is looking a bit small, there are a couple of tricks. If I just double click the image, so this is my left clicker, double click, you'll get a single picture. And I can expand this up now, go full screen. Now we get a clearer view, and you can see this is the PDL space, which is the black line, and that's the lamina dura, the white line next to it. So we get a really nice view. That's my single image. I'm just going to close that to get rid of it. And that's how you line up a single tooth. Okay, so now we're coming to the third video. We've got our scan set up how we like it. Let's look at some skills here. Now, the first thing I told you was about anatomy, and we need to check the anatomy. So remember I said about the antral outlines. So here I'm indicating antral outlines. Here they are. And of course, if we move the axial line up, we'll also get the antral outlines in the axial plane. And this is really important. When we look at a panoramic, we see the antral outlines of the trough, but when we look on Comium CT, we get the antral outlines looking in the three planes all together. And notice the antral outlines are thin, pencil lines. And there's also a lovely curve to things. There's curves, 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 curves. That's really important because those natural curves will tell you if something is distorting or deforming them. And as I move around, you can see that we get a lovely picture of the antral outlines intact. What we've got is a little septum, totally normal, allowed to be there. You often get antral septa. This will be very likely incomplete, i.e. it will end somewhere. It's unlikely to entirely divide up the antrum. The other anatomy we can see here is the nasal cavity. Now, I wouldn't worry too much about the nasal cavity because it's a specialist area in itself. Just so you know, these are what turbinates look like. So they're the inferior, they're the middle, and then we've got a septum down the middle. And it's totally normal to have one side which is open and freer. And see there's much more black air here versus this side, which is far less. This is a normal thing called nasal cycling, and often one nasal passage is wider and more open when compared to the other. Okay, we did the antral outlines, really important things to check. The other thing in the mandible I asked you to check was the mandibular. So let's start up with the mandible, and now we can start to see the ID canal. And as I rotate, you'll have a nicer view. Look at the ID canal looking really nice there, up to the mental foramen and all the way to the back. We can also see the lacy trabecular pattern holding the teeth in, and we see a relative sparsity inferior to it. Here's the ID canal in coronal section. There it is sitting there, and you'll see it moving with a nice rounded shape further back. Up here, we've got trabecular pattern holding the teeth. Down here, we've got that sparsity. Remember, this is normal, it's to be allowed. The best way to assess the mental foramen is definitely up here in the volume view. So you can see on this view, we've got a single mental foramen, but remember you can have bifid or even trifid variants, and it's important to comment on those, especially if you're doing implants. Okay, we've now checked our important anatomy. Let's go on to measuring some root lengths. So let's go and measure the root for a single rooted tooth. I'm going to measure that tooth, which is the upper left 3. I'm going to position it on the 3, and then I'm going to do the lining up that we talked about earlier. So line the tooth up, line the tooth up. There we've got a nice picture of the tooth. I'm going to take the lines off, and I'm going to measure that tooth. So I've got it at, and I'm doing click, move, click, move, click, move, double click to finish, something like 26. But I'm also going to double check in this plane and make sure I've got a similar measurement. Click, move, click, move, click, move, double click, and we've got, okay, a slight discrepancy, but overall pretty close. I think if you're within 0.5 millimetre, which we roughly are, then that's okay. The other thing I'm going to do is measure the angle. I'm going to go back to pointer. Now I'm going to measure the angle of the root compared to the angle of the occlusal plane. Let me just spin this around slightly, and then we go measure angle, click to click, and then the occlusal plane is click to double click. I can see here this is my measurement, roughly 52 degrees. So that can be helpful if you're pulling a tooth down, want to know the angulation of it, want to know whether it's optimal, suboptimal, etc. These measurements I've taken hide down here in the software. So see at the moment we've got this angle measurement. If I unclick, it will disappear. If I click, it will come back. So I'm going to unclick, which means I'm going to hide all these rather than delete them. Now let's look at some root canals and measure some root canals. So let's choose a tooth which has got several roots, such as this tooth here, which is the upper left 4. 1, 2 root canals. Let's measure those root canals. Let me put the coloured lines back on. Let's line the tooth up best we can. For the palatal root first. So how long is my palatal root canal going to be during my root canal treatment? I'm going to choose measure. I'm going to choose where my stop is going to be. I'm going to go for there. So I go click, 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 click. And then double click to finish. So I've got a measurement of about 22.46. Go back to pointer. And then that measurement, I can hide it here. But I could also rename it here and call this upper left 4 palatal root canal. Just click away and you see it saves it there. Then I could hide it and then go for the other root canal. So the buccal, so I'm going to line up the buccal. Now this root canal to me looks like it curves away. So it means that we're not going to see it in all 3 views. So I'm going to line it up best I can in one of the views, which is probably going to be now. Then I'm going to measure and see how I'm going from the cusp. There we go. And I'm going to call this upper left 4 buccal root canal. So there you go, I've got my 2 estimated working lengths, 23 for the buccal and about just under maybe 22 for the palatal. And those are my estimated working lengths. Remember to use all 3 planes when you can. 1, 2, 3. So when we've got pathology, and some of you might see there's something going on in the mandible down here, target it. Target the pathology, line it up best you can, and then get a view of it in 3 planes. And we get a view here, here, and here. A view in 3 planes is really, really helpful. The final skill I'm going to teach you today is about making what's called a curved MPR. So if you get up to the top here, this box here, curved MPR. Click on it. It'll give you an axial view. What I'm going to do then is come down here to Tools. Click this button and we get a plus. Click, move, 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 click, move. Double click to finish and we'll get a nice picture. Now this is fairly thin. I can right click, thickness, and increase the thickness and it will look more like a DPT. And if I keep going with that, it will look even blurrier, but we'll get more of the anatomy in. Conversely, I can tell the thickness to be narrowed right down to 1 millimeters and it will be exactly just that line, but it means we'll get lots of spacing and lots of teeth missed. So this 20 mil is probably something reasonable for this to give us a nice view. There's a nice view of the panoramic. If you're doing this, you get something wrong, you can change the points here. So see, I'm modifying the point. So let's say you get it wrong and you put it here and you say, oh, this doesn't look right here. You can grab the little red dot that you put and move it. If you got things totally wrong, you can erase it. Go back to draw it again. Click, move, click, move, click, move, click, move. You can't come out here. It won't work. You'll just get from here an area of no data here. So you've got to stay within the data set. So let's delete that one again. And do one more time here. Click, move, click, 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 click. Double click to finish. Goes back to pointer, and then we get this nice view. We will learn on the masterclass, if you come on it, what these 3 views are. You'll also learn things like drawing the nerve canal, adding an implant, sculpting the volume, rendering, things like that. These are all skills we can teach you on the masterclass. So there's our nice panoramic style view. Here's us looking at pathology in 3 views. Thanks very much.